Hey guys, so I just wanted to give you a little update on what happened with me over the last few days. And my throat is really scratchy because I had to have emergency surgery and they had a tube down my throat, so my mouth is all bruised. Inside is like even all like torn up, so I don't really know what happened, but even inside of my lips are torn. My throat is in complete agony from the tube. And then I was vomiting from the anesthetic, and it burned so badly every time I was vomiting because of how raw this is. But what happened was on this past Wednesday, oh my gosh, I can't even keep track of my days. I went in to see my doctor. Oh, such a bad migraine. I went in to see my doctor on the follow-up over this miscarriage to make sure that I had everything, discharged naturally, which I didn't think I had because they had explained to me the stages would be, blood clotting, and then I'd have something about the size of a golf ball come out of me, and then I would know that the fetus was out, and that never happened. So I spent 7 hours at the doctor's office on Wednesday with Kurt, and they saw that the fetus and the sac and all that was still inside of me. So they said that I had to have surgery to have that removed because I was at risk of infection. And I take Enbrel, which puts me at even a higher risk for developing any kind of infection because of my rheumatoid arthritis, and methotrexate, and I'm on the highest dose of both methotrexate and Enbrel that a human can take, along with a lot of other medications. And then I was explaining to the doctor that at that point it had been 7 days straight, I was experiencing like extreme debilitating pain on mainly the left side of my stomach, but it kind of would radiate downward and then kind of fade out to the right side, and my whole lower back was like in agony. And during that time I was still trying to film for you guys and just push through it, and I was getting all my videos done and I was filming for you guys on a daily basis, but I would have to take breaks because I would get these sudden pains and they would just knock me to the ground, and I would be screaming, and I would try to stretch, I would try to like hurl over, I would try any position, and nothing I could do would help with these pains. So they started with the ultrasound, the one that goes inside, not a topical ultrasound, to check my ovaries. And she started on the right side, and she said my right ovary is extremely enlarged. And then she got to my left ovary and she said it had torsioned, and I had a 5 centimeter, it turned out to be 5.5 centimeter cyst on it. And that 5.5 centimeter cyst was actually bigger than my ovary itself, so it kept causing it torsion. I didn't even know what the word was. That means the ovary keeps flipping. And then because every time the ovary would flip, it cuts the blood supply off. So she said I had to rush to the ER because she couldn't perform that surgery in her clinic. And that had to be dealt with first, and then the sac had to be suctioned out of me with the fetus. And she wanted it all done in one surgery so I wouldn't have to be put under twice. So she sent me to ER, but I had to come home first. I said I'm not coming home to say goodbye to my dogs just in case something happened, because there were so many risks with this procedure and complications and things that could go wrong. So I came home and I took care of my dogs. One of my dogs takes medication, and I fed them, and I gave them all their hugs and kisses and like my goodbyes because I just didn't know what was gonna happen. And I was so scared because I've never had any kind of emergency surgery before. If you guys watched my confessions video, you know that I've had a breast augmentation, and I mean, you can clearly tell when I'm in little tops and stuff that I've had that. But I had like 6 months to prepare for that surgery and get to know my doctor. And get that comfort level and everything else. And so that was different, and of course I was still scared to go under, but this was a complete different situation. So after being with that one doctor for 7 hours, Kurt and I came home and did everything we had to do at home, and then we went to the ER, and we were there for 21 hours after the first 7 hours at the other one. And they ran so many tests, like they took over 15 vials of blood, but they had to take it on 3 separate occasions. The first occasion, she had to take so much blood from both arms. It was unbelievable. Like, I thought I was going to pass out. She had to keep checking on me because she just couldn't believe the amount of blood they ordered to be taken. They did urine tests, and then they had to go in another time to take more blood. They had me hooked up on an IV with fluids, anti-nausea medication. They started me off on morphine. Morphine wasn't enough. They bumped me up to another pain medicine dosage, or type of pain medication that I don't even remember what it was called. And so they had me constantly on this drip. And then they did their own ultrasound where they did both topical and when they go inside you. And then at that point my ovary had flipped back, and they said that that's probably why I was having so much pain. Like, my ovary just kept flipping back and forth, and every time it flipped the wrong way, that's when the pain would just hit, and that huge cyst was causing so much pain. But then all my blood came back, and it still showed that I somehow had low hormones, a positive low hormone for pregnancy. So then the doctors are telling me they think that I might have had a twin, but that somehow the twin was in my tube on the left side, and when they were examining the images, they said that it looked like it was in the fallopian tube on the left side. So they might have to remove my tube, and they might have to remove my left ovary. They didn't think that they might be able to salvage the ovary, and they couldn't explain how I'm still having these low positive hormone results for a pregnancy when the one sac that they saw was a clear miscarriage, and that one said that I was anywhere between 5 to 6 weeks. They were able to give me a more definitive answer on how far along I had been in my pregnancy before I miscarried. But it turns out I didn't have that second baby in the tube, so thank goodness my tube didn't get removed and my ovary didn't get removed. They were able to salvage both, and they were able to get rid of the cyst and get rid of the sac in the fetus. Right now I have 2 incisions, and one in my belly button and one like in my pelvic region, and my stomach is just so bloated out, and I'm in so much pain. Every time I cough, I try to clear my throat, I blow my nose. It's like I can feel my left side, and that the ovary has just been like beat up. Like it hurts so bad. So they sent me home with painkillers, which I've not taken because I was throwing up since I got home. So I didn't want to take any painkillers. Obviously, because of all this, there was so much stress. I've had crazy migraines from it. I'm on bed rest until Monday. They ordered bed rest for 3 extra days after they released me from the hospital. And for 2 weeks, things like I can't pick up anything over 10 pounds, which is 2 of my dogs I can't even pick up. And then even laying in bed, my boys like to cuddle up in my tummy, and every time they do, it hurts because they end up hitting an incision, or my pants hit the incision on the wrong place. And I haven't been able to travel with my family in a couple of years because of law school. And my health was so bad while I was in law school and dealing with my abusive relationship and all that before I met Kurt. So I just stopped traveling because I would get sick for anywhere from 4 to 6 weeks at a time. But the law school forces you to go to school even when you're sick. So I couldn't do both. I couldn't travel and manage to get through law school. So I just stopped traveling for a couple of years until I was done law school. So my first family trip was finally coming up in a week and a half. No, in a week. And my parents had to cancel it, and they were going to take Kurt and me to Jade Mountain in St. Lucia. It's a really awesome, huge, like, vacation because we haven't been able to travel in so many years, and I've been through hell and back. So they were really treating us to this beautiful trip. And now I can't go in the water. They ordered no swimming, no pool, no hot tub, no sexy time. But, you know, no tanning, which I don't really do anyway. But there's all these orders that I can't do anything. So I can't even travel to the trip that we were going to go on. So we've had to, well, we're going to postpone it. It's canceled right now, but we are going to go back on it, or go on it at a later date. But I was just so looking forward to spending that time with my family, and now we can't even do that either. The good news is that they were at least able to solve all the issues in my tummy in one surgery. I didn't have to have multiple, and I go back for a follow-up appointment in a couple of weeks. I was mainly impressed with the hospital, but what I wasn't impressed with was I kept telling everybody how I take methotrexate, because I went in there wearing a mask and my eyeglasses because I'm so susceptible to catching viruses and different diseases. So hospitals are like deadly for me to be in. And protocol when a patient is on methotrexate, because they use it as part of for chemotherapy treatment too, is that the nurses are supposed to wear a mask around you in case they're carrying anything, because they're going from patient to patient to patient, and they're dealing with all varieties of patients, you know, some that are in there because they have a flu, some that have pneumonia. And I've been told that because of the different medications I'm on, if I ever developed pneumonia, I'd have 24 hours to live, and there's nothing that they could do for me. I would just be gone. And it wasn't until I was in there for like, I want to say 15 hours of being in the hospital before the nurses finally started wearing masks, where the manager found out that they weren't wearing masks. And then the manager ordered them to all start wearing masks every time they came into my room. But the whole time that they kept dealing with me, they weren't wearing any. So I'm just hoping that I didn't pick up anything from them in the meantime. And now I just have to make sure that I don't develop any kind of infection in the meantime either, because for some reason they didn't give me an antibiotic. So I see my actual doctor on Monday, and I'm going to talk to my doctor about an antibiotic, because I don't understand how the ER was so willing to give me like all this pain medication and send me home with a high dosage of pain meds that I don't want and I'm not taking, but not an antibiotic, even as a preventative based on my Enbrel and methotrexate, that puts you at an insane risk of infection with having these 2 incisions and being so beat up inside. And like, everything is so sore. Like, my arms are so bruised from everything, all the needles, and it was just a hell of really the 29 hours of doctors and coming home and fasting. I mean, I had to start fasting at 5 p.m. on Wednesday, and they didn't even start the surgery until 9 or 10 a.m. the next day. Like, it was insane. I was so hungry, so thirsty. And I mean, those are minor in comparison, but it was a hell of a couple of days. There's just so much that I don't understand, and I'll never have answers as to why so much of this happened. And I know I'm missing things right now to let you guys know, but I mean, I think I hit most of what went on anyway. But I do have to get back into bed. And I'm so bummed because I wanted to. Obviously, I'm so behind in replying to you guys on comments. And I can't even have the laptop on my lap because the way it ends up hitting the incisions on both my pelvis and my belly button, I can't even sit there with the laptop on me answering you guys. And texting hurts after like a couple texts because my wrist is so bad with my arthritis, so I can't even sit on my phone answering you guys that way. And I feel so bad that I haven't been able to reply to you guys and talk to you guys. Like, it kills me not being able to answer you. Like, you have no idea how bad I feel that I'm not talking back with you guys. And then I had an Easter request to do some pastel looks, and I had planned on filming Thursday and today, which is Friday, 2 different Easter looks. I even bought 2 pastel palettes that are different from what I have because they looked so much better, so that way I could actually create, I was hoping, some nicer pastel ones with, like, I even picked up some gems and the special tools so I could create it. Like, I had different visions. And I don't think I'm going to be able to fulfill that request in time for Easter now because it's already Friday and I have to be on bed rest. And I now all I can do is lay in bed until I get better. But I just want you guys to know that I'm thinking of all of you, and I mean, not a second goes by that I don't wish that I could be communicating with you guys and letting you know what's going on with me every step of the way. Like, I really, I hate when I can't talk back with you guys, so I just wanted to let you know that this is why, and why I've been in so much pain the last couple of weeks. That is, I've been through hell and back for the last few weeks, and just being able to film, edit, get the videos up have been so hard enough, and now I know why. And now hopefully come Monday, Tuesday, I'll be back to myself and I won't be in so much pain as I am right now. And so I hope that you guys all have a really wonderful Easter weekend and that I can start talking to you guys really soon. I still have a bunch of pre-recorded videos, so now that I'm home I can at least start getting videos up for you guys too. So I can still rest and get the videos up. I just feel so bad that I can't fulfill the Easter request tutorial. And the other requests that I have, I've written them all down, and I know those ones weren't like time sensitive, so I can still fulfill those as soon as I'm better. But I'm so sorry to the one person that requested the Easter one. I'll still do a pastel look so that way you have it because it's springtime. I'm so sorry you're not going to have it in time for Easter, and you would have because I even bought palettes for you for that. But I need to get back to bed, so just know that I'm thinking of all of you and I love you guys so much. And hopefully I will be doing a video, like an actual more live video, not pre-recorded ones that are going to go up come Monday when I can get off of bed rest. So until then, I love you guys so much and I hope you're all well. And I will talk to you later. Bye.